rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hello everyone. Today I saw a patient who had recently undergone transurethral resection for non-muscle-invasive bladder cancer. He asked, "Doctor, what are the chances that my bladder cancer will come back or become more aggressive?" Rather than making assumptions, let's take a closer look. Our patient is a 68-year-old man with non-muscle-invasive bladder cancer after TURBT. He has 3 papillary bladder tumors, with the largest measuring 2.5 centimeters. Pathology confirms T1 disease, WHO 1973 grade 2, with no concomitant carcinoma in situ. He has experienced 1 recurrence within the past year. Let's assess this case using the EORTC 2006 NMIBC Recurrence and Progression Tables in the OncoToolkit. The EORTC calculator estimates the historical risk of tumor recurrence and progression for patients with papillary TA and T1 non-muscle-invasive bladder cancer after TURBT. Let's enter our patient's information. First, we'll select the number of tumors. Our patient has 3 tumors, so we'll choose 2 to 7 tumors. Next is the largest tumor diameter. The largest tumor measures 2.5 centimeters, so we'll select less than 3 centimeters. Now we'll enter the prior recurrence rate. The patient has had 1 recurrence during the past year, so we'll choose 1 or fewer recurrences per year. Next is the pathological T category. This patient has T1 disease, so we'll select T1. Now we'll indicate whether concomitant carcinoma in situ is present. There is no concomitant CIS, so we'll select no. Finally, we'll choose the WHO 1973 tumor grade. Pathology shows grade 2 disease, so we'll select G2. Now click Calculate Score. Here are the results. The patient has a recurrence score of 7 out of 17. Based on the original EORTC cohort, this corresponds to a historical recurrence probability of 38% at 1 year and 62% at 5 years. The progression score is 9 out of 23. This corresponds to a historical progression probability of 5% at 1 year and 17% at 5 years. These estimates come from the original EORTC study cohort and should not be interpreted as individualized predictions or treatment recommendations. To see how the result was calculated, expand how this result was calculated. The calculator assigns separate point values to each clinical and pathological feature. The recurrence score and progression score are calculated independently using the original EORTC scoring system. You can click Copy Result to copy the assessment. To save the result, enter the patient's name and click Save. Previously saved assessments can be accessed from the Saved Results panel on the right-hand side. The Clinical Workflow section provides additional guidance on interpreting these historical risk estimates. These tables were developed from patients with papillary, TA, and T1 non-muscle-invasive bladder cancer treated with TURBT. They provide historical cohort-based estimates and should always be interpreted together with current clinical guidelines and multidisciplinary assessment. If you'd like to learn more, scroll down to the reference data below. Here you'll find the original EORTC scoring tables showing how each clinical feature contributes to recurrence and progression risk. These correspond to historical probabilities of 38% recurrence at 1 year and 62% at 5 years, with progression probabilities of 5% at 1 year and 17% at 5 years. For more oncology calculators and clinical decision support tools, explore the OncoToolkit website.